From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Okay, Dr. Laura Wilson joins us today from Sherwood Family Medical Center. Going to do something a little different today. The flu's kind of died down a bit. Yay, glad about that. Still out there, though.
Yes,
so
still out there.
Wash your hands. But we want to talk a little bit about childhood depression today. We've heard a lot in the news that has kids worried.
Right.
You know, so you want to talk a little bit about that children can be depressed.
Right, and this was kind of on the heels of the American Academy of Pediatrics' new guideline that came out that recommended annual screening for adolescents and teenagers for depression. And doctors can use screening scales to look at these things annually at their well checks. So when that came out, I thought this would be a good time to kind of review the topic. Interestingly, this will probably shock a lot of people, up to 20% of kids will experience an episode of depression during their childhood. Right. At any given moment, 5 to 10% of kids, 5 to 7 to 10% of kids may be depressed, but in their childhood, 20%, so that's 1 out of 5.
Yeah.
And this rate is increasing, which is very worrisome. And in Arkansas in particular, our rates are increasing, and that's paired with decreased access to mental health services. And so in one recent analysis, Arkansas actually ranked at the bottom of the list for number of teens and children with depression and accessibility to services. So number 51 out of the 51, I guess that includes DC.
Yeah, okay.
With that, we've also seen an increased rate of suicide, and that has tripled in the past 3 decades, which is a little scary, right? And so time for us to really look at what we're doing, make sure we're catching these teens, and make sure people are talking about it.
And studies show a lot go undiagnosed. That's the mental health,
right.
resources.
Many are undiagnosed, and even those that get a diagnosis, oftentimes they don't end up getting treated, either because perhaps the family doesn't follow through like they're supposed to, or maybe just because there's not people to see. There's not counselors available, especially in some of our rural areas. I think there's a very huge lack of services in those areas.
Okay, so we have to watch the signs.
Right.
And what are some of the things to look for?
So withdrawal is the #1 thing to look for, and that'd be withdrawal from family, from friends, from activities they normally find pleasure in. You know, if they used to be an avid runner or love going to the mall or the movies and all of a sudden they don't care, that's very concerning to me. Obviously a decrease in school performance, the grades are dropping, changes in eating and sleeping patterns. So it can go either way with these. We're sleeping a lot more, we can't sleep. We're eating a lot more, we don't eat at all. So big deviations in their normal eating and sleeping patterns. Anger, a lot of teenagers have a little bit of anger, but excessive anger, getting angry over things that shouldn't upset them. And the biggest key with all this is impairment, right? So if you have kind of a moody or angry teen, but they still have friends, they're still going out, they're still doing well in school, that may not be quite to a depression diagnosis. If these symptoms become an impairment, the kid can't function socially, academically, that's where we're probably getting into more of a diagnosis. And that really is kind of across the board for a lot of mental health disorders. You know, families come in worried about anxiety or obsessive thoughts or things like that. Well, if it's not an impairment, we may not be quite to the diagnosing point. That being said, if there are concerns, talk to your doctor. Right? I don't mean to downplay any of it, but the first thing to do, and this is the next visual we have coming up, is to talk to your PCP. A lot of people, I think, shy away from their primary medical doctor because they think, well, they can't do behavioral, they can't do psychiatric stuff. Your primary doctor is a great starting point, right? So go in, sit down and talk, the parent and the teen. Oftentimes the doctor will talk to the teen individually or child, and then talk to the parent individually to kind of get an idea from both sides what's going on. The doctors, again, can use screening scales, and this is a way to kind of objectify some of the symptoms. From there, if we meet diagnosis or even have kind of just a little bit of concern, we can start some counseling and medication potentially if the child needs it.
Even if it's not classified as depression, the moodiness, I mean, sometimes a counselor can help with that.
Oh, definitely. And I tell families all the time, some of the counseling is just to help the child cope with these emotions, right? So if you are kind of a volatile or up and down emotional person, that may be how you are for life, but counseling helps you learn to cope with that, right? And can teach you skills even into adulthood.
With kids' depression, we always hear social media kind of sometimes being part of that they see everybody's perfect life, so-called perfect life.
That's exactly right. And we do think social media is increasing the risk of depression and maybe even suicide with cyberbullying. FOMO, have you heard this? Fear of missing out. That's from my niece recently. I learned that word. And again, perceiving everybody's life is very social and very perfect in all these airbrushed pictures, and we think that's very real.
And everybody's having all these great parties and fun, and I'm not.
And I didn't get invited.
Exactly. It's not real life. That's what a counselor will tell them. Okay, there is a crisis hotline. We want to be sure everybody has that, and this is just really for any concerns you have.
This was traditionally called the suicide hotline. We've kind kind of gone away from that name.
Right.
But mental health awareness or suicide prevention hotline, it's 1-800-273-TALK. And this could be for you personally, if you're having any concerns for suicide or excessive depression, or perhaps if you just know somebody, you can call and they can help you get plugged into some resources.
Okay, I love that we covered this. And like you said, don't be afraid to talk to your primary care about this. They may refer you on, but it's a great place to start because that's who you're comfortable with. Thank you,
Right, sure.
Laura, we appreciate it.